So HARMONi-6 is a trial that assessed ivonescimab, which is a bispecific PD-1 VEGF antibody. The VEGF component being anti-angiogenic, but also targeting the immunosuppressive effect of VEGF in the tumor microenvironment. So it's anti-angiogenic, but also a kind of immune regulator and working together with the PD-1 inhibition. So ivonescimab had demonstrated in the past to be effective versus pembrolizumab as single agent in PD-L1 high metastatic non-small cell lung cancer, HARMONi-2 trial, published in the Lancet. And here, this is a trial that combined ivonescimab plus chemotherapy versus chemotherapy plus tislelizumab, which is a PD-1 inhibitor quite similar to pembrolizumab. This is a positive trial in terms of PFS, moving from 6-7 months PFS to 11 months. So clearly a significant, clinically meaningful PFS benefit. We also see this benefit in PD-L1 negative tumors, which are more hard to treat because less sensitive to immunotherapy, with a lower proportion of responders becoming long responders and long survivors. We do not have yet the overall survival data, but I expect that with this magnitude of benefit in terms of PFS, we will have a significant OS benefit in the future. So it reinforces the fact that ivonescimab is a very important drug for the patients with non-small cell lung cancer. The international trials replicating those trials conducted in China, so HARMONi-2 as single agent, this is HARMONi-7 internationally, HARMONi-6 that we just saw during this meeting. This is HARMONi-3, which is ongoing in multiple sites. So it will also reinforce, obviously, the need to enroll patients in clinical trials in the first-line setting. In terms of safety of ivonescimab plus chemo seems probably a little bit better than in the previous reports with ivonescimab. Probably there is a learning curve. But here, this study, HARMONi-6, focused on squamous cell carcinoma. And this is the first time that we have an anti-angiogenic agent in squamous cell carcinoma that shows this magnitude of efficacy in lung cancer. So overall, it shows that we need to be confident with this drug, ivonescimab. And there are actually multiple other agents with a similar mechanism of action, PD-1 and VEGF bispecific antibodies. Everything has changed not only for the locally advanced unresectable, integrating not only the Pacific regimen, so consolidation immunotherapy, which was in the previous version of the guidelines, but also integrating consolidation with EGFR inhibitors for those patients with EGFR mutated locally advanced unresectable non-small cell lung cancer. And for the patients with resectable disease, everything has changed with the integration of neoadjuvant and perioperative chemotherapy and immunotherapy, which is now the standard of care for the patients starting from stage 2 disease and in the absence of EGFR mutation or ALK rearrangements. For EGFR mutated non-small cell lung cancer, this is adjuvant osimertinib. It was in the previous version. And for the ALK positive, this is adjuvant alectinib, new in those guidelines. So it was very important to have a clear update of the non-metastatic non-small cell lung cancer guidelines because of the new data that came out over the past years. To generate real-world data, for sure, it's very important. It allows to capture not only the efficacy of one given line of treatment or one given drug, but the whole sequence. And we know that patients in the real-life setting are receiving multiple lines of treatment, which may impact overall survival. We know that one strategy or one sequence may impact the next one. For example, we know that after immunotherapy, chemotherapy may work in a different manner. It's even more true in patients with oncogene-addicted tumors. We know the impact of the previous lines on the efficacy of the subsequent lines. So generating real-world data is very important. It should be done in a systematic manner, to make sure that not only we are reproducing the data from the clinical trial in all the patients, in larger or broader population, but also to study this sequencing and interactions from one line to another.